And let's take you live now to the Ghana Health Service, where the Greater Accra Regional Directorate of the service is addressing the public on the rollout of COVID-19 vaccines.
Being vaccinated either with the AstraZeneca vaccine or with the Sputnik V vaccine that we did. So if you live in these districts that I've talked about and you are 18 years and above and you have not been vaccinated with either the AstraZeneca or Sputnik V, and you are 18 years and above, then you are eligible, with the exception of pregnant women. So anybody, individuals 18 years and above, they are all eligible, and who have not received any vaccination, they are all eligible. As usual, of course, priority will be given to people, the aged, that is 60 years and above, and also individuals that have either other comorbidities, you know, the priority will be given to them. But then at the end of the day, everybody who is within 18 years and above is eligible, but you must be living in these districts that we have spoken about. And we are also hoping and entrusting that everybody who falls within the range will take advantage and ensure that they get vaccinated. In each of the districts that we have spoken about, from Monday, in all our district hospitals, it will be rolled out and people can go and take the vaccine. The only thing that we would like to stress is that when you are going, you must take an ID card that will identify who you are. And apart from your ID card, also make sure that you have eaten. When you go to the vaccination center, just let's ensure that we observe all the safety protocols that have been put in place. That is, we should wear our mask. We should also ensure that, you know, we'll make sure we provide hand hygiene facilities, which could be either running water, you know, with soap, or alcohol-based hand sanitizer will be available. You just sanitize your hands. As you sit down, you observe the social distancing and wait for your turn, and you all have the vaccination. We would like to encourage all the people within these districts that we are talking about to ensure that they take advantage of this opportunity and get themselves vaccinated. In addition to observing the safety protocols, we believe that all these measures will protect us all as we continue to fight against this COVID-19 pandemic. So thank you very much. Thank you, Director, for the brief and concise information to everybody living out there. I want to know if any of us have any clarification that you want a response.
Mentioned that pregnant women will not be able to take the vaccine. I want to know if people with peculiar illnesses or people who are taking a particular kind of drug.
What you want to know?
So if there are any drugs that if you are on any medications that you are taking that could prevent you from taking the Johnson & Johnson vaccine. Yes, and also if there are any particular illnesses that if you are treating, you can't really go and take the vaccine.
With the exception of pregnant, everybody is eligible. If you are acutely ill, it's better to
Hello, any question?
But if not, whatever condition.
Good morning.
Good morning.
I'm not speaking clarity, though. You mentioned that the vaccines will be administered in district hospitals. in these districts? I want to know.
Public health facilities.
Okay.
So polyclinic, health center, hospital. Yeah, within the district, they will make sure that they set up various vaccination centers, just like what we did with the Astra. Yes, just like
that. They will not
that.
have the situation of people coming into the community.
Oh, they will do. Yes, every district with planning and will make sure they just like what we did. Yes,
I
yes.
wanted to get the exact number of districts, the total.
7 districts in all have been targeted for this exercise. And then, since I answered you, I think I'll also answer the lady's question. I didn't know who you were. Like we said, it's only the pregnant women who are exempted and will not have to take this Johnson & Johnson vaccine. But then everybody 18 years and above. But we should note that it's for those who have not been vaccinated. Even if you have had your first dose of AstraZeneca, you are not to take it, because definitely you are going to get the second dose of Astra. So for everybody who is 18 years and above, you are not pregnant, and you have not so far received any of the COVID-19 vaccines that we give, you are eligible. Just as we would like to advise that if you are acutely ill, then maybe you want to wait to get well and then have the vaccinate. But everybody, no matter what you are. Thank you, Director. Any more questions?
The director said they are looking at 100,000 people to be vaccinated. And we know that the number of people who have been vaccinated in the region far outnumber that. We know that the vaccines that were also received were more than 100,000. Do we know what informed the decision to allocate 100,000 to the Greater Accra region? And how are we making sure that the places will not be overcrowded? Because I covered the second phase of vaccination. A lot of people went to a lot of health facilities. They did not get the vaccines because the vaccines were not enough for everybody.
I think you know that COVID is all over the country. It's not only in Greater Accra region. So I want to believe that, the distribution is done based on the, regions that they are distributing it to. And I think I would not want to go into how, but we are all aware that we're told that about 177,000 doses of the Johnson & Johnson vaccine had arrived. So what I'm saying is that what we have been given, we can, for now, ensure that 100,000 doses or 100,000 individuals receive the Johnson & Johnson vaccine. Yes, we will make sure there is no overcrowding. So, there are 7 districts that we have talked about. All the 7 districts have planned their vaccination centers. And in addition to the public health facilities where we'll have it, I believe just like what we did in the previous times, there will be vaccination centers set up in the community and in other areas. And we are very much aware that we have to observe the social distancing protocol, and we'll make sure we do it. So far as you are in the district, I believe that the district health team or the district health management team will ensure that they give those the details of where their centers have been allocated. But then I'm saying including those details, at least all the public health facilities will be also giving out the Johnson & Johnson vaccine. But we also like to stress that everybody, at the end of the day, like I think we've been told that the Ministry of Health, the government, Ghana Health Service are all working very hard to ensure that we get adequate vaccines to ensure that the entire populace is covered. So at the end of the day, as we roll out gradually, everybody will have his or her turn. So there is no need for us to rush. If you are not living within the 7 districts that we have spoken about, there is no need for you to rush and go there, because you will also get your turn. And I'm sure even before the month ends, I'm sure there will be lots of vaccines around to ensure that everybody is protected. Thank you. Any other question? Do you want to say anything? You want to say anything? Okay. Okay. So when we finish, okay. But this thing hasn't come in. Okay. We'll give them a handout so that they can somehow say, okay, so close it and then, okay. So we want to say a very big thing.
So that's the latest from that news conference from the Greater Accra Regional Headquarters of the Ghana Health Service. The key point is that the Greater Accra region expects to distribute some 100,000 doses of the Johnson & Johnson vaccines. Remember, these are single-shot vaccines, so it's expected that 100,000 people will be vaccinated by the end of this exercise. Let's move to other stories. This is Joy News Today here on the Joy News channel. We've also brought to you earlier, we've taken you to Daboya and also, of course, which is near Wale Wale in the West Mamprushi district of the Northeast region, which is in dire need of a nurse at its health center. We'll take a few messages at this point. We'll be back with more stories.